All right, let's dive right in. Welcome to this explainer, where we're going to decode one of the most fascinating and honestly sometimes frustrating systems in human physiology. Today, we're talking about hyperthyroidism. Think of your body as a super complex, highly tuned vehicle. Every vehicle needs an engine to determine how fast it runs, right? Well, in your body, that internal engine is the thyroid. It literally controls everything from your resting heart rate to exactly how efficiently you burn energy. But what happens when that engine just gets stuck on overdrive? Well, that is exactly what we're going to explore today. Here's our roadmap for today. We'll start with the body's internal engine, move into what happens when things speed up, and how to spot the warning signs. After that, we'll cover diagnosing the problem, taking back control, and finally, we'll wrap up by comparing hyperthyroidism with hypothyroidism. Okay, Section 1, the body's internal engine. Before we can understand what goes wrong, we really need to establish a baseline of what a healthy, normal physiology looks like. So right there in the front of your neck sits your thyroid. It's this small, butterfly-shaped gland. But don't let its size fool you, because this gland is the master conductor of your body's energy. It produces two main hormones, triiodothyronine, which we just call T3, and thyroxine, known as T4. I want you to think of T3 and T4 as the direct fuel injectors for your body's metabolism. They circulate through your bloodstream, dictating your heart rate, managing your body temperature, regulating your brain and muscle function, and even overseeing your digestion. And the chain of command here, which we call the hypothalamic pituitary thyroid axis, is just incredible. Look at how perfectly the brain communicates with the neck. Step 1. The hypothalamus in your brain sends out a signal called TRH, or thyrotropin-releasing hormone. Step 2, that signal tells the pituitary gland to release TSH, which is thyroid-stimulating hormone. Finally, Step 3, TSH acts like a knock on the thyroid's door, basically telling it to release our fuel injectors, T3 and T4, into the body. In a healthy system, this is a perfect feedback loop. When hormone levels are just right, the brain simply stops knocking. Moving on to Section 2, when things speed up. So what actually happens when that perfect feedback loop breaks down? This is the absolute core of it. Hyperthyroidism is the state of the engine running on absolute overdrive. The thyroid goes completely rogue and starts pumping out massive, excessive amounts of T3 and T4. Imagine your car sitting in the driveway in park, but the engine is just revving at 7,000 RPMs constantly 24/7. That is exactly what your body is experiencing. Your cellular metabolism speeds up wildly, forcing all of your vital organs to work so much harder than normal. Your heart beats faster, your body generates excess heat, and over time, because you're burning through energy so incredibly inefficiently, you start experiencing gradual, profound muscle weakness. Now, the most common culprit behind this is Graves' disease. This is an autoimmune disorder, meaning the body's own immune system gets confused. It creates antibodies that actually mimic that knock on the door we talked about earlier, endlessly stimulating the thyroid to just keep pumping out hormones. And a very distinct hallmark of this specific condition is how it affects the eyes. It can actually cause a condition known as proptosis, which is bulging eyes, along with severe irritation and even double vision. But Graves' disease isn't the only way the gas pedal gets stuck. You might also encounter what's called a toxic multinodular goiter or a toxic adenoma. This is basically when one or more little lumps or nodules grow on the thyroid and start independently pumping out excess hormones, totally ignoring the brain's signals. Then there's thyroiditis, which is an inflammation of the gland that causes it to just leak all of its stored hormones at once. And finally, external factors, like taking too much thyroid medication or being exposed to excess iodine, can also throw this delicate system into overdrive. Let's look at Section 3, spotting the warning signs. We know what's happening at a cellular level, but how does this physiological chaos actually show up for a patient? If you connect these symptoms back to our speeding engine metaphor, it makes complete sense. If your metabolism is on hyperspeed, of course you're going to see weight loss, even if the patient is eating normally or honestly eating a ton more. The heart is racing, which is known as tachycardia. The patient experiences intense heat intolerance and sweating because the body is generating so much excess thermal energy. Mentally, this translates to severe anxiety, irritability, and physical tremors. It is absolutely exhausting. And it's really important to note that this condition most commonly affects women between the ages of 20 and 50, often bringing along things like hair thinning and menstrual irregularities. Now, if the warning signs we just discussed are ignored, the condition can escalate into a sobering, life-threatening emergency known as a thyroid storm. A thyroid storm features an extremely high fever, severe agitation, vomiting, and a dangerously rapid heartbeat that can literally lead to heart failure. I really want to stress this. This level of overdrive requires immediate emergency hospital intervention. This is not something you can just sleep off. All right, section 4, diagnosing the problem. Once someone shows up with these frantic warning signs, how did doctors actually measure the chaos? Well, remember our feedback loop from earlier. If the thyroid is pumping out massively elevated levels of T4 and T3, what does the brain do? The pituitary gland recognizes there's way too much hormone, so it just stops sending the signal. It completely stops knocking on the door. Therefore, when doctors draw blood, they typically see a very low TSH level combined with really high T4 and T3. This blood test perfectly captures the brain's desperate but ultimately failed attempt to hit the brakes on a speeding thyroid. Beyond that initial blood test, doctors have an incredible toolkit to pinpoint exactly what's causing the surge. They can test for specific thyroid antibodies, like TRAB and TSI, to confirm if it's Graves' disease. They use a thyroid ultrasound to visually evaluate the size of the gland and look for those rogue nodules we discussed. A radioactive iodine uptake scan visually demonstrates exactly how and where the thyroid is absorbing iodine to make those hormones. And crucially, an ECG or electrocardiogram is done to protect the heart, detecting any dangerous rhythm abnormalities, like atrial fibrillation, that the rapid metabolism might have triggered. Section 5. Taking back control. So, we've got the diagnosis, now it's time for action. And the fantastic news here is that highly effective options exist. The first pillar is usually anti-thyroid drugs, like methimazole or PTU. These literally block the thyroid's ability to make new hormones. Now, while those take a little time to kick in, doctors will often prescribe beta blockers immediately. This eases the rapid heartbeat and tremors, giving the patient instant symptom relief. For a more permanent fix, radioactive iodine therapy can be used to safely target and destroy the overactive tissue. And in severe cases, or if there's a massive goiter, surgical removal of the gland, a thyroidectomy, is performed. Keep in mind, definitive treatments like radioactive iodine or surgery often mean the patient will require lifelong, simple daily thyroid replacement medication. Basically, you're trading an unpredictable overactive thyroid for a perfectly controlled, supplemented one. Now, once the medical team stabilizes the hormone levels, we enter an incredibly important, but often overlooked phase of recovery: physiotherapy. The physical body still has to recover from the trauma of all that prolonged metabolic strain. Remember that muscle weakness we talked about? Physiotherapy is essential to rebuild muscle strength, reverse wasting, and restore lost balance and posture. But it is absolutely crucial to note that vigorous exercise must be completely avoided until the hyperthyroidism is medically controlled. You literally cannot put physical exercise strain on a heart that is already running a marathon while sitting perfectly still.
And finally, section 6, hyperthyroidism versus hypothyroidism.
Before we wrap up, I want to make absolutely sure there is zero confusion between these two opposite ends of the thyroid spectrum. Everything we covered today was hyperthyroidism, the overactive engine. The metabolism is fast, resulting in weight loss, a rapid heart rate, and severe heat intolerance. Hypothyroidism is the exact opposite. The engine is barely running. The metabolism is incredibly slow, resulting in unexplained weight gain, a super slow heart rate, and feeling constantly cold. Understanding this binary totally changes how you view what the body's actually going through when the thyroid malfunctions. So, what's the big takeaway? Hyperthyroidism takes a heavy, completely exhausting toll on the organs and daily life. But the incredible news is that through early diagnosis, targeted medications, and dedicated physical rehab, early intervention puts control right back in your hands. So it really begs the question, are you tuning out the subtle warning signs your own internal engine might be sending you?